Hi, so my name is Russell Bahar. I'm in my second year of residency at the Integrated Community Stream of Family Medicine at the University of Toronto. I did my training at University of Toronto as well and grew up in North York. So rural medicine to me has always been about being a generalist, a true jack of all trades, and having the opportunity to do lots of different things and really follow the patient experience throughout the courses of outpatient care, emergency care, hospitalist, OB, even doing OR assistant, things like that. And that's just been something I've always really been passionate about. I couldn't see myself just doing clinic or just doing, one thing. So having the opportunity to train in all dimensions of care in that sense and the flexibility that is inherent in rural medicine is something I've always been really interested in. So it's just me and one other resident. I think in previous years it's sometimes been even only one resident. It's cool in that, you're still able to communicate with each other, but we don't really see each other a whole lot in clinics. So it really does feel like you're, an independent resident working in a rural setting. For me, it's definitely the flexibility. I've really appreciated being able to have a lot of say in terms of where I want to go. And I think if you're a self-directed learner, having the opportunity to carve your own path through all the different opportunities and experiences in family medicine is a real benefit to being able to do a rural residency. Even more recently, my main preceptor actually just gave me the opportunity to make my own schedule, which I don't know anybody in any residency that has that kind of opportunity to control what they have the opportunity to be exposed to. So I think it's really about being able to carve your own path and given the flexibility and ability to do that. So I'm an emerge guy. I've always really liked emergency medicine. I'm doing my fellowship next year as a PGY3 in emergency medicine, and that's always been something I've really been interested in. What's cool about it in the rural setting is you get to still affiliate with outpatient, like you still get to follow up with these people in clinic, and you can also work as a hospitalist the next day and follow up on see how their care was for people you've admitted. So it's a bit broader, I think, the scope of care you do in emergency medicine and rural settings, and that's something that's always really appealed to me. Yeah, so I still am involved in a research project I started in my first year of residency in the integrated communities. You do 1 year at a community site. So I trained at Michael Garron or Toronto East General, and then a year at my current rural site. And in my first year, I did a research project on pediatric sepsis management, designed a tool that was implemented at that hospital. And I'm still doing some work specific to that type of research. So I'm auditing it at this point, and also seeing if that kind of infrastructure could be moved over to my current site at Port Perry to see how it can maybe help in similar ways, even though it's a different setting. Well, prior to COVID, I like to think I had lots of hobbies. Now it's a little bit tougher, but I really like, music. I've always been really interested in physical activity, working out. I used to rock climb and cycle a lot. I mean, it's tough now with winter and current situation, and I'm an avid reader as well. So again, it's nice to keep plugging the rural experience because you have so much flexibility over your schedule. You have a lot of opportunity to still pursue your hobbies and do things on the side while getting such a great learning experience and such a great education. You still can make time for other things, which is really nice. So my hope is to do a bit of locuming. I mean, I'm planning on doing a primary emergency practice. So my interest is in perhaps returning to the place I first trained at Michael Garron, or a community site similar in size, just to get a lot of volume in for the first few years and build up my experience dealing with really emergent cases. And then after that, I think what's fantastic is there's so much variety in terms of where you can work with training in family medicine, especially in rural medicine, where you do so many different things. So I like the idea of doing some locuming and doing some work in more rural communities, perhaps coming back to Port Perry for a bit of time. I mean, it's not the case that you'll have a hard time finding a job if you are trained as a generalist and are willing to travel and work in rural settings. The need is there, and it's just a really fantastic ability to go wherever you want, work wherever you want, and it's something quite unique, I think, to this field. My one tip for any medical students interested in rural medicine is take the time to actually get out there and experience it for yourself. I was in my first year, and when I had heard about it, and as a medical student, I wanted to do internal medicine, and I was going to work at UHN, and that was my plan. And that was the plan until I did internal medicine, and then it was no longer my plan. But during electives, I had the chance to do a great elective in Barry's Bay, which I had never heard of. And between organizations like RMAP or ROMP, or even just talking and asking around family residents and different people you may know and networking to find a chance to actually do some shadowing, or if you're in a clerkship position, to do your electives or selectives, whatever it can be, just get out there and experience it, because I think a lot of people would be surprised with how fantastic a work environment it is. And there's just so many little benefits. I don't have time to go over it, but experience it for yourself and make a decision about where you see yourself. I think a lot more people would be interested in it if they took the time to get out there and realize how fantastic it is to be working in rural medicine.